would also like to request our Honorable Chief Minister to please sign the Hyderabad Declaration. The moment we all have been waiting for has arrived. I request our Honorable Chief Minister to please address us.
I think it's a pleasure addressing you here. I have known Dr. Reddy as a young boy and was seeing Mr. Reddy start his first hospital. I had taken my father for a checkup in Madras. I was in college there. I have seen the growth of Apollo hospitals, and he has seen my growth in politics. There is a common factor for us. Both of us come from the same district, Chittor. I am very happy that we are here. I would like to make a suggestion first and go into it. You have made a Hyderabad declaration, but for friends who are not here throughout the world, they will have to go into the net to find out where Hyderabad is. So if you change it as Hyderabad declaration, no one has to go into the net. So I think you please consider your declaration, because it will have a brand name of its own. Hyderabad has got a brand name of its own. What is technology all about? Where did we start from? Of course, I am not very old, but even when I was young, there was no electricity in the village. We did not have telephone in the villages. We did not have TVs anywhere in the country. I think TV came into Hyderabad in 83 or 82. We did not know what a cell phone was. But how has everything changed? It has changed because of only one thing. When technology is made affordable and the common man, it reaches the common man, that is the sole reason of change in technology, and that is where we are today. I think it has changed so much. I don't know how many of you know what a trunk call is. The youngsters, I think below 20, 25, will not understand what a trunk call is. When we were young, if you wanted to call up another town or city, we had to call up in some places. There used to be operators. We had to book a call. Sometimes it used to take, we used to have ordinary call, urgent call, lightning call. And it used to take us sometimes days to reach out to talk on the phone. And today, our airports are as busy as the bus stations or railway stations. Even this has happened because it has become cheaper and affordable to the common man. When technology changes and it is in the reach of common man, affordable, that is the key for change in everything. We did not have the internet, we did not have so many things. The other day I had gone to a company in Hyderabad where it is monitoring and giving signals for 50% of the flights in the world. The total monitoring is happening from Hyderabad for its landing and takeoff and the weather condition throughout the world from Hyderabad. Technology has changed so much. We are trying to implement technology in every field, including the medical field by the government. We already have a 104 service and Arogyashri service, which we get about 20,000 calls, medical suggestions and medical problems are addressed in the phone every day. That is, the government is doing it even now. As far as we have got a unique program for the poor, basically for operations, because they cannot afford the operations, called Rajiv Arogyashri. We have finished about 15 lakh operations from the last 3 or 4 years. This year itself, we are going to do about 4 lakh operations with about 1400 crores with the help of the private hospitals. This is both the government hospitals and the private hospitals put together. Every doctor, when the patient goes to the hospital who requires an operation, sends an email to a specialist doctors. We have got about 3 doctors in every field in Arogyashri to check up whether that operation is necessary or not. And within 24 hours, the specialized doctors give a concurrence that this operation is required for the patient or not. And the private hospitals are doing an excellent job helping the government and the poor patients. In the state of Andhra Pradesh, I think this is the only state in the country where we are trying to capitalize on good hospitals for the benefit of the poor, including the private hospitals. I think we cannot take medical care and medical health care to every citizen in the state without the support of the private hospitals. And we have got the best hospitals. I am proud to say we have got the best hospitals in the country in Hyderabad, which is looking after not only the patients who can afford, but the patients who cannot afford also. Even the poor men, they are taking care of that. I hope you have a good conference here. I think it's a 3-day conference and a lot of new ideas will emerge from this conference. And unless we have new ideas coming up, which are easier, which are going to be more pro-patient and for them, it will be easier for them to take care. This program will surely become a success. Here we have started another program to control the IMR and MMR, where nearly 16 lakh pregnant women are being tracked by the state government about their health and medical advisories to the pregnant women. This is all rural people, most of them are rural women. Nearly 16 lakh mothers from the last 10 months, they are tracking their progress regularly and they are giving suggestions how they should go ahead. In all fields, as far as the state of Andhra Pradesh is concerned, IT is an important factor for us. In the field of scholarships and fees reimbursement, nearly 25 lakh students, it is all online, where the students get their scholarships, their admissions, everything is online. As far as in the rural areas is concerned, we have got a very big poverty elevation program among the women, where about 1 crore 40 lakh women are members in these groups, Indra Kranti Padam. About 14 or 15 lakh groups are there, where they do transactions with the bank, and we are giving interest-free loans to them. They take about 13,000 crores of bankers finance these groups to the extent of 13,000 crores in a year. This year's target is 13,000 crores. And the total interest is paid by the state government. And mind you, all this is online. The interest to the accounts is sent online by the state government. If Aadhaar card, which is coming up, I think 75% of the country's Aadhaar cards we have finished in Andhra Pradesh, and we would like to finish it by March or April. We are trying to link up all services through the Aadhaar card, and so that it becomes very helpful for the citizen, where we can link up everything. The government, whatever he gets from the government, it could be ration, it could be scholarships, it could be for a new house, or it could be for anything. So we would like to link up the whole thing with IT, including health services. So I thank Mr. Dr. Reddy for inviting me here, and I am sure that this conference will have a lot of benefits, not only to the state of Andhra Pradesh, to the whole world, because so many persons from different IT companies and doctors trying to come for having new technology, how to use the new technology and how to make it more friendly to the patients. I hope it is a big success. And I think we will have a better world or better hospital systems after your conference. Thank you very much for inviting me here. And I wish all the dignitaries or doctors and from the IT company, people who have come from other states and other countries, to have a pleasant stay in Hyderabad and have a good stay and take back sweet memories. Thank you very much, and I thank them again.
This conference is already amongst the largest healthcare, IT and patient-related conference in the world. Two gentlemen and a naughty boy have been responsible for this conference, and I would like to request you to felicitate them. The first gentleman is Dr. Ganapati. May I request Dr. Ganapati to come on stage, please? The other gentleman is Suresh. Suresh, please come on to that. And finally, the naughty boy, Gaurav.
Thank you all of you, but I can just say that this wouldn't have been possible actually without so many people who worked day and night in different ways to make this conference